Hello everyone, welcome to my channel. We'll start with today's question. The nurse is reviewing discharge instructions with a client going home on linezolid therapy for a vancomycin-resistant enterococcus infection. Which client statement requires further teaching? So we know that when we are choosing a question in that which statement requires further teaching means some of the statement made by the client is wrong. So client requires further more information, then only they will get a proper understanding of this medication and the instructions what we are giving based on the discharge. So the first option here says, I can restart my paroxetine once I get back home. Option 2, I can take acetaminophen for headaches. Option 3, I will avoid foods and drinks that contain tyramine. Option 4, I will report any increased fever or diarrhea. So out of these 4 options, which option you think that is wrong made by the client? So any of these options might be wrong. So when the client will make that wrong option, we should stop and we should educate them more. So here the first one said that I can restart my paroxetine once I get back home. So the paroxetine is what kind of medication? This is an SSRI medication. SSRI is in the sense selective serotonin reuptake inhibitors. So and we know that the linezolid it has an MOAI properties, which means monoamine oxidase inhibitor properties. So when a client who is on linezolid therapy and he is concurrently taking SSRI medications, it can lead to serotonin syndrome. How the serotonin syndrome will develop? Because in accumulation of serotonin will increase and that will lead to serotonin syndrome. So that is a complication, it's a severe consequence of this combination of these medications. So while a client who is on such kind of MOA medications, the doctor should instruct them, they should not take any other kind of medicine that will make a serotonin syndrome or that will accumulate the serotonin in the body. So that's why the option 1 is wrong. In the first step we got the answer. The option 1 kind said that he will restart the paroxetine. He cannot restart. After 24 hours of discontinuation of linezolid, client can resume the paroxetine medicine. So that's why the option 1 is the answer. We will see why other options it's not became the answer. Option 2 says that I can take acetaminophen for headaches. Yeah, that is not an problem. It's not a contraindication. So client can take acetaminophen. Then option 3, I will avoid foods and drinks that contain tyramine. That is also a correct statement. Then option 4, I will report any increased fever or diarrhea. That is a correct statement because we know that diarrhea is one of the symptom that is included in serotonin syndrome. So when the client states that they have increased diarrhea means it can be something related to serotonin syndrome. So that is also a correct statement. So except to option 1, option 2, 3, 4 are the correct statements. Only the wrong statement which is made by the client here is the option 1. That is I can restart my paroxetine once I get back home. I hope it's clear and you can see the descriptions related to this drugs and how it is connected. So if you have any doubts, you can just mention in the comment box.